Oh, hi. Sorry, I'm just pretending to be Cleopatra, which I'll get into later, why I'm pretending to be Cleopatra. And have you ever wondered why your back just freaking hurts so freaking much? Well, one of the multitude of reasons is the quadratus lumborum muscle. What is the quadratus lumborum muscle? Right up there. You see that? So think about your lower back and how it connects to your pelvis and to your rib cage. There are two muscles that connect. They're called the quadratus lumborum, just like what I said. And when one side becomes more compressed than the other side can become painful because the tissues are being pulled long. And so when you go to physios, you go to doctors, they look at the pain point and they say, okay, let's have surgery, or yeah, you have some. But what about looking at the compressed side? Well, that's the side that needs to be released and lengthened so then both sides can distribute weight and gravity and ground reaction force when you're walking evenly, and then pain be gone. So how do you know which side is compressed? Well, let me show you. Now, I may stand up and I may go out of frame, that's okay, but you can see right here, hopefully you can see which finger is a little bit higher. I'm trying to hold my fingers evenly. It looks like my right side is. So what that means is my pelvis on my right is higher or my rib cage is lower. We don't know which came first, the chicken or the egg. It's not important. But this is the side that I want to release. You can release it with a ball. We're not going to do that right now, but I will go deeper into it in my holistic movement class that I post every week. And hint, hint, nudge, nudge, you can watch that. I'll post it somewhere. I don't know how the hell I do that link thing. Anyway, we're just going to do the stretch. We want to just stretch the shortened concentric side, the locked short side. Why would I want to stretch the tissue that's already in pain and being pulled long? It's kind of like when there's someone injured and they're lying on the floor and just go up and just punch them again or just kick them right in the throat. Why? And this is what most physios and doctors go after. They go after the pain point. They have the horse blinders on. Let's take the horse blinders away and look at the big picture. And the big picture is we need to take away the compression. And when we take away that compression, like what I just said, both sides can evenly distribute weight within gravity and when you walk due to ground reaction force. So I'm going to lie on my right side, just like Cleopatra, the iconic painting. It always makes me think of that iconic painting. You know, the one right here. I'll post it right here. You can see it. Now, I'm going to first lie on my right forearm here. And I'm going to have my left leg over like this. And then I'm going to straighten my right leg. I'm going to engage my quads here. And I'm going to push my right heel away. Now, maybe you're asking, but Rob, I don't know which side. Well, again, sale number 2, cheap sale number 2. Watch my holistic movement class, and then I can help you determine which one it is. If you're not sure, just do that test that I just did to see which one is higher, and that's the side that's more compressed. Or email me, or put it in comments here. Rob, I need help, and then I'll get in touch with you, and then I'll teach you how to do it personally. That's how devoted I am to helping you get out of pain. Okay, now, my right forearm is right under my right shoulder, and I'm going to show you from the back here so you can see it a little bit better. I'm going to pull up my shirt so you can see my lower back. Bring that left leg over, straighten this left leg. Then I'm going to come up onto my right arm, and that way it'll lengthen the rib cage and create distance between my rib cage and my pelvis. Then I'm going to push that heel away and lengthen my heel. Now, then I can feel it in my obliques and my lats as well. Because get this, it's not only the QL that you're lengthening, you're also lengthening other parts of the lateral line, part of anatomy trains terminology, or the deep front line. See those pics? Okay, now, and maybe you'll see from this camera angle, I'm going to rotate my rib cage to my left, and that's going to pull obliquely and from different force vectors. That's a vector, Victor. And then I'm going to rotate back. And you may not even feel it in those particular areas. Wherever you feel it, it's not wrong. But see if you can close your eyes and breathe into that. And then the more that you bring that right hand closer to you, more of an angle you can get on lengthening that QL and those lats. Then watch this. I'm going to tilt my head to my left and try to bring my left ear towards my left shoulder. And then I get the scalenes to pull on that quadratus lumborum, which is part of the deep front line. Yep, and then I breathe right into that right QL. Stay for about 30 seconds to a minute, and then come on down, let's rest. And then maybe you're asking yourself, but Rob, what about the weak side? What about the painful part? Well, sale number 2. Sorry, is that number 3? The trifecta of sales. Now it's time for you to watch my other video on how to strengthen the QL. Yep. We're all salesmen selling ourselves, folks. I'm going back to being Cleopatra. Someone grapes, please. Grapes.